Photobiomodulation. Photo, light, bio, life, modulating, changing. I'm Dr. Peter Wilcox. I'm an optometrist. I have a deep interest in doing a yet better job of assisting people who want to retain their ocular health and recover their ocular health that has been lost to macular degeneration or glaucoma or optic neuropathies and inflammatory diseases. So why use light? Well, because if we didn't have the sun, we'd all be dead. Nobody would be here. And you can have good light and you can have bad light into the eyes. And the intensity of the light, the duration, the different qualities of light you can have are all very important. In certain cells, there's sweet spots in the wavelengths, the span of wavelengths that the body sucks up these photons, and good things happen with the metabolism in our body and the ATP, the adenosine triphosphate, and all this other funny words that get into it. I'm not going to go into that right now. I'm going to talk about just why we use some of these tools. One of the earlier things I used is this Violite. This is out of Canada. Dr. Lou Lem. This may look silly, but it works. Transcranial, what happens is there's a system for having a probe that goes up your nose and through these different pods into specific parts of the brain where you get transcranial and intranasal light. Notice I have two different units here because the brain has there's different wavelengths that the brain is appreciative of at 40 hertz and 10 hertz, and a hertz is a cycle per second. So if you have a waveform that goes, if it starts here, it goes down and comes up to here, that's one wavelength. If you have 1 in a second, that's 1 hertz. If you have 10 in a second, that's 10 hertz, and so on and so forth. Then you have the intensity and the amplitude. The intensity would be the difference between a pencil or a Sharpie drawing a line. And the form, sometimes it's a nice curve, sometimes it's a sawtooth form, sometimes it's a square wave, and all these things matter as to what our body needs, what has been proven to be beneficial for cognitive disorders, for the dementia, the Parkinsonism, the Alzheimer's, for the TBI patient, and for numerous disorders. I encourage you to go to the websites of Violite, Vielight, and another one, Wellread. They're out of Australia. Wellread, I use their technology as well. I'll plug this in because it's pretty interesting. Transcranial, okay, so see how intense these lights are? More exposure to the brain, and intranasal light that's going into the brain. And you sit here for 12 minutes of red light in the far red wavelengths, and then there's 12 minutes of near infrared light, so it's 670 and 810 nanometers. And you wake up, you do this stuff in the morning, it improves your cognitive wellness, and it'll pull you out of a state of demise. Over the years, numerous patients have purchase these things and use them, and we have images and scans of the retina that show that they've improved ocular health, and that's why we use them. So red light, there is this pain away laser, okay? It uses the same thing. It uses different forms of light that the person can put on their body. And I have this device. I tend to gather things. But you have a sore shoulder, people can use this. Anybody can purchase them online. All this stuff available online. And so we're using light to improve the body by assisting the cells and giving them the energy they want. A plant uses chlorophyll in order to make energy, and we have chromophores in our body that absorb this light and then improve our detergescence. It improves our what's called autophagy. Autophagy is when you have a healthy cell and you have a dead cell, and you have in between you have dying cells, and you want to get rid of the dying cells, and it helps you slough those things off. So as an eye doctor, with knowing that the eye is brain tissue, it's part of the diencephalon. If you and all that is there's a part when the human's developing that you go, wow, it looks like I can separate this thing into 5 parts, and one of them is called the diencephalon, and the eyes are part of that. So as an eye doctor, we actually can and see neurodegenerative disorders. And so a sick eye is equated to a sick brain, and vice versa. So that's photobiomodulation. We had some in the Hocket. We have some on the Beamer. And what we do is I teach people. We use it in the office. And since this takes a while, the encouragement is just to educate people with them knowing that they're going to go out and purchase some of these technologies. And they have different price points. And all those things can be discussed with you. So that's photobiomodulation, and I thank you for your time.